Dr. John Adgate is professor and chair of the Department of Environmental and Occupational Health at the Colorado School of Public Health. He has long been interested in the health impacts of oil and gas development, has been studying them, and is here to present to us today on the health impacts. I present Dr. John Adgate.
Hello, everybody. Can you hear me, first of all? Okay, good. I'm actually not going to talk much about the health impacts. What I really want to talk about is public health. And that's what I wrote my talk about. I was told 20 minutes. This is a modular talk. It could be 20 minutes or 60, but I'm not going to make it 60. What I do want to tell you a little bit about is I want to start by talking about how I got involved in this. I moved to Colorado in 2010. And before I moved here, I was a faculty member at the University of Minnesota, and I worked a lot on human exposure to things like benzene and toluene and stuff like that, and I want to touch on that just a little bit because it's one of the things that got me interested in this as a public health problem. And you know, the boom of unconventional oil and gas development has really, you know, as our previous speaker mentioned, led to a lot of interesting and unfortunate issues that I think we need to address as a society and as a state. Now, my talk in particular is going to be focused on a lot of things that we've done, research that we've done in Colorado. If you think of the last talk and the big stack of research that has been published that's been sort of going up rapidly, we've contributed in our own way to that. I also want to point out that I work in an ecosystem where I've got a number of colleagues that have helped and contributed to this. Ben Blair, Lisa McKenzie, Ben Alshouse, and others that you'll see on some of these papers. So I lay no claim to all the work that was done by me, but I do want to talk about not just our work, but I think sort of a larger frame of where some of the peer-reviewed research comes in sort of dealing with the public health issues around oil and gas development. So in 2014, I published with some colleagues a review, sort of the first major review article on oil and gas development. And to sort of think about the problem, we put this together because, you know, as I'm sure several speakers have mentioned, there's a lot of different things going on in this process. And it's, you know, there's everything from water quality and air quality to very specific exposures that have very, you know, relatively well-known health effects. I mean, there's 100 years of research on benzene in occupational environments, for example, that really can contribute to our, you know, sort of addressing this issue. There's particulate matter air pollution. We've recently done a lot of work on noise because that's actually, I think, a really important kind of co-exposure. And the thing that's sort of understudied, you know, we look at things, we tend to look, as scientists, we tend to look at things one at a time. And what this whole sort of mixture means is really what's important. Now, there's other things that, you know, you can see other things on this graphic here. Now, one thing I want to point out, mostly what I'm going to talk about today has to do with what I'm going to call residential exposure, because that's really where the population at risk is. And I'll explain more what I mean by population at risk in a bit. Now, there's a whole set of exposure issues around workers, sort of the red in the middle of this bullseye graphic that I'm really not going to address. But that's, you know, the #1 population at risk, but it's smaller than the literally millions of people nationwide who live within a mile of one of these sites and one of these sort of rapidly expanding sites. Now, there's whole other pieces to this that you know, I just want to be aware of is, you know, sort of social disruption and ozone are just two, I think, that are important here in Colorado and elsewhere. We are still out of compliance with the national ozone standard on the Front Range, and that's an issue that's not going to go away. Oil and gas contributes to that, and how we address that and all these other issues in response to you know, this particular environmental health issue is I think, something important. All right, just a real quick frame. I like to put this in all my talks just to give people some context about, I knew nothing about petroleum engineering before I started this job, started working on this problem. And I can at least play one now on television, I think, not that I want to. But my important point in showing you this is, what the regulatory regime that's grown up around this industry and the public health impacts of it were really developed around vertical drilling, where it was one well at a time spread around. Now, I just, for the nth time, just drove up I-25, and I'm always struck by the number of sites you can see just driving between Denver and here. What's striking about it is you used to see the old pump jacks a lot more, but now what you see is a lot of these multi-well pads, which is really what's in the sort of the lower right-hand corner of this slide. And that's really the issue now, because we've gone from little single point sources, as the air pollution people say, to these large multi-well pads. They're really industrial facilities, and they're part of a large set of infrastructure. It's not just the well pads, it's the pump, it's the the gas compressor stations and pipelines and things like that. So horizontal and directional drilling has led to a whole new set of I think issues, and it's what we see in the tension around setbacks in this state and in other states. For those of you who are from out of state, you've probably already heard a little bit about we're a ballot initiative state. We just went through a cycle where people tried to have a 2,500-foot setback put in the state constitution, and it was voted down in November. But I think it's an issue that's not going away. So what that means and how it might be implemented and what it means for public health is really what I want to talk about today. So just real quick, the other thing I'm going to sort of touch on is there's these various phases when they put these well pads together. They prepare them, they drill them, they frack them, and then eventually they're in production for 20, 30 years, although exactly how long an unconventional well is going to produce is still, I think, remains to be seen. It's a little different process. But one of the lessons from our work and others people's work is that what really matters in this are some of the high exposure periods where a lot of pollutants are emitted. And that's typically this period called hydraulic fracturing and flowback, when water and petroleum is flowing back out of the oil. And that's an largely uncontrolled process. There's what's known as green completion, but how green it is and what the emissions are around that is something that I think should be discussed, and it's where sort of regulation, I think, the rubber will hit the road. So in the time I've got here, and according to this big television I'm looking down at, I have 18 minutes left. These are my three sort of central questions that I wanted to talk about and have a discussion about. A little bit about what are the key residential exposures related to unconventional oil and gas. What does public health mean in this context? I've talked a little bit about populations at risk, and I'm not going to talk a lot about some of the work that we've done. It's been, I think, mentioned already, but the frame of population at risk and how many people and what we can do about it, i.e. what interventions are possible, are really where I want to end up on this. And particularly talking about things that I'm using the term clinically actionable because I was told this is a medical symposium. I'm a public health person, so I'm not a clinician. But I want to talk about the things that are actually possible at the population level, and those are things like setbacks and emission controls. And the interesting spin in all this is the impact of multi-well pads and how monitoring plays into all this. Now, Detlef is going to talk after I am, and he'll talk about some of his work and monitoring and what that means. So I'm going to touch fairly lightly on that topic in anticipation of what he's going to talk about. Well, so the main things I want to sort of touch on just a little bit are what I'm calling here key exposures. And so there's a lot of acronyms here. The ones in blue are the ones I want to touch a little more deeply on. NM HC are non-methane hydrocarbons. That means BTEX, benzene, toluene, ethylbenzene, xylene, and some other related compounds, which are conventionally called hazardous air pollutants. There's the 6 criteria pollutants, like particulate matter, but really the big emissions around these sites are the hydrocarbons and the ones where the health risks exist and the uncertainties are. There are a lot of diesel engines that release particulate matter and black carbon and polyaromatic hydrocarbons and contribute to the ozone problem. But that's actually a less studied issue at this point. And the thing that really seems to get people's attention is the BTEX exposures, the benzene and related compounds. Now, one thing I will say is that from my perspective as somebody who's been working on this a number of years, air is a bigger problem than water. There are instances where people can become exposed via water from spills and contamination of wells, but in terms of the number of people potentially exposed, air pollution is a much bigger issue. And really that's sort of a frame for the talk. I'm not saying that water pollution isn't important in certain contexts. It absolutely is. It's probably a bigger issue in Pennsylvania, for example, in the Marcellus than here because we tend to drink a lot of surface water and not as much groundwater. We don't have as many, I think, potential complete exposure pathways around water. Mentioned briefly noise because both the A-weighted and C-weighted, that's the difference between those two things is the noise you can hear versus the noise you can feel are really important around these sites and really are a big nuisance to the folks that live nearby. Other issues like traffic and the potential for catastrophic risk, by which I mean things blowing up at, are important key exposures that you should be aware of, but I'm not going to go into it a whole lot more depth. So what do I mean by all this? Air pollution affects a large number of people. Flowback is important. What's really important in terms of protecting people, the people who live nearby, is this whole issue of proximity and periodicity. What I mean by that is, the more people who live close to these sites, the bigger the public health issue because there's more people exposed. The tricky part of all this and sort of demonstrating safety, however we define it in this, and that's ultimately where the rub is in this in terms of setting setbacks and reassuring people about what might be a health threat is what I'm calling episodic exposures. There's a lot of things that go on in these sites. Some days you'll go by them. We've had monitoring equipment around a couple sites for better part of a year, and some days there's not much going on, and some days emissions are 100 times higher. And by that I mean air pollutants, I mean noise. It just depends on what's going on, and that's really what affects people's health. Now these other things, the amount of truck traffic and compressor stations and pipelines also contribute to this, and how that is related to public health and to what people experience and the stresses it puts on their health are really what's important. All right, so I want to walk you through just one example of a multi-well pad and how that affects the number of people exposed. We did some work a couple years ago trying to figure out how many people in the state of Colorado live within a mile of an oil and gas well. We had a number of different sort of data sources, included some housing data, housing price data. And what we did is we ended up coming up with this estimate, and this is a 2012 estimate, and I'll talk about what that means in a sec here, that there were about 355,000, this very precise number, 355,781 living with 1 mile of an oil and gas well in the DJB, the Denver-Julesburg Basin, which is, I just drove through part of it coming up here from Denver. So the headline estimate here, more than 378,000 Coloradans, is a bit of an update, but it's one of the points in doing this analysis is we saw that the setbacks are, one directional. It used to be our setback was 350 feet. It's gone up to 500 feet. The 2,500 feet one was proposed. Is the people are living closer to oil and gas wells, especially once the well is established. And And I'll talk a little bit about a twist on that in a second. So the setbacks only are in one direction, and more people are sort of moving closer to them once they're established. Now, you'll see there are a couple of different other numbers floating around nationwide. The 9 million number was cited earlier. If you count conventional oil and gas wells, the population is estimated at about 17 million people. That's a lot of folks. If you think about, in a country of 330 million people, there's 17 million people living within a mile of one of these facilities. And as I said, folks are moving closer for reasons that have to do with how setbacks are set up. I mean, once the setback exists, once an oil and gas well exists, you have the setback, but there's nothing stopping people, for example, in the state of Colorado from building closer, i.e. within the setback. Now, to walk you through this and also pull in the idea of multi-well pads and why they're important going forward is just this little, sort of pictorial timeline of one well that's turned into many wells. And this is work we did as part of putting together that paper. So in 1999, 2003, there's a lot of people moving to Colorado to see the mountains and enjoy our weather and environment. And increasingly, these well pads, once they're established, get expanded. You have related infrastructure like pits and other things that are involved. Here you've got, in this case, in 2008, we had houses within 343 feet based on the Google map. And then, houses were built in the other direction. So if you sort of cycle through this, eventually, this isn't the same site, but this is an example of a multi-well pad. So we're going from, as I said, single wells to multiple wells, and this is, where the risk, particularly for folks living closest to one of these big, and I would call them industrial operations, exist. So this is the one thing I'm going to say about the hazardous air pollutants and monitoring is that, and I'm sure Detlef is going to talk more about his study, but essentially what this means is with the density of unconventional oil and gas development, the air pollution levels go up. That's not a big surprise to anyone, right? Now what I'm showing here is on the left is a map and a concentration scale in Colorado. The paper on the right is in Pennsylvania, and they basically show the same thing, is density matters. And so what matters around this is what sort of emission controls and or setbacks should we have to protect public health, to protect those people living in close proximity. All right, so public health is, medicine is about treatment. Public health is about keeping people out of doctors' offices and hospitals. So it's really about interventions in the end, is how do we keep people from becoming sick. So I'm wanting to close this out by talking about what I'm calling clinically actionable, what sort of emission controls ought we be thinking about, and really the last thing is setbacks and how we monitor within setbacks. What sort of compliance should we have? I'm going to leave open the question how far is far enough, because there's a lot of different answers to that question. I can think of people talk about the 2,500 foot setback. I can think of examples where 2,500 feet is not far enough, but I can also think of examples where 500 feet is plenty far, and that's the problem with sort of a one-size-fits-all setback. Both as a scientist and as I think what we want are efficient public policies that will protect folks, but how in the end, how do we demonstrate that? What sort of compliance should we have? One thing you see increasingly talked about, and I think there was a speaker at the beginning of the day that was talking about personal exposure and monitoring, what I'm calling biomonitoring for BTEX. You can measure BTEX in blood. I helped publish a paper in 2005 where we actually looked at BTEX levels in more than 100 kids in inner city Minneapolis. And so I have some background in this. And one of the things that I think is important about these particular measures is that it's hard to interpret them. And it really depends on what you were exposed to recently. if you pump gas today, it has a big impact. And so the benzene from there and the benzene from other sources is hard to disentangle from the benzene from the oil and gas wells, for example. So it's a challenge. If we're going to push in that direction, you need to think about what the background levels are in the population. And we have not, despite years of work in the occupational environment, established a health-based standard for benzene or any other compound in blood. Because it's a challenge. So I'm not sure that that's the most fruitful approach. It's certainly worth doing in some contexts, but it requires very sort of careful controls and quality assurance. We're working hard on biomarkers of health effects. There's a number of different biomarkers in some of our research studies, but none of those are sort of ready for sort of clinical use, I would say, and that's unfortunate but true, and sometimes hard to hear. But there are a number of people working on that and trying to do that in a way that I think can inform public policy. The Health Effects Institute, which is a nonprofit, I've been to a couple of their meetings in the last year, is very interested in I think, funding studies that look at that particular issue as well as exposure. All right, so setbacks, this is the issue in the end. This is the big public health intervention. So I put a couple of quotes in here. This is one from the former head of the Colorado Oil and Gas Conservation Commission talking about sort of the complaints they got. I won't read it to you, you can read it, but it's all about all the other things besides the hazardous air pollutants is really what they get if you actually systematically go through their complaints. And I've had somebody actually do this analysis, and it turns out to be true. When he said this, he said, "We believe the jury is still out on air emission impacts." There's a new head of COGCC, and we have a new governor, and I think this issue is most certainly going to be revisited. I think a sort of interesting take on all this, Matt Fry wrote a paper in this journal, Energy Policy, talking about analyzed every setback in the state of Texas. And in the end, now Texas has a little different set of rules than Colorado does. I mean, one of the issues here is that state has primacy and there's not local control. I think those of you who are Colorado residents know this. So in the end, after looking at literally hundreds, I believe, of setbacks, if I remember the number right, he decided that, or his conclusion was that distances tend to increase over time, but in the end there were political compromises, just because the science didn't exist. Now you're going to look at me as an academic and say, well, of course you're going to say this, but science hasn't had a big say in a lot of this, and I think it's important that it is included, just because in the end, we'd like to have sort of technically based, I think, setbacks in a way that both experts and the public feel, I think, reassured and trust, both government and regulatory bodies. So this is a collage of what's happened in this state over the last few years. We had the previous governor, Hickenlooper. We had a statewide task force that sort of looked at this and sort of ground, in my view, sort of ground to a halt. Matt Lepore is in the middle there. Our new governor, Jared Polis, and our former governor, Hickenlooper, are on the upper right-hand side here. We just, last November, had this tug of war about Proposition 112, which was the 2,500-foot setback. And in the end, it's going to end up in our state legislature now. And I've already personally had inquiries, and other people in the room, I'm sure, are involved in trying to figure out what's the next step in terms of local control and reassuring folks about the health impacts associated with development. So I sort of end up here, some final thoughts related to this, and these are really thoughts in process, I have to say, because I've been thinking about this, how, if setbacks are the right way to protect public health and what else we could be doing. So what we do know is exposure varies with the phase of development, emission controls in place, and the size of the facility. Monitoring data shows that air pollution levels increase with the closer you get. That's what I mean by proximity here. The kicker in all this is that local atmospheric conditions are likely important in determination of worst case. What I mean by that, on days where it's cold in the morning and people are at home, what's called the mixing height, where the air ends up and its ability to be mixed as the atmosphere heats during the day is very low. So pollutants will be trapped near the ground. That's the worst case, and that's what we have to look at in terms of protecting public health. How do we address the risks at that particular time? Because that's when, for example, the BTEX levels will be the highest. And it also happens to be when, because it's often early in the day, and it's when people are at home. What don't we know? So there's a lot of things we don't know, particularly around acute health effects at various distances. Our risk assessments address this issue and show that it's certainly an issue worth working harder on and getting better data about. But there really, in the end, there aren't sort of clinically actionable things in terms of exposure or health effects we can do. I think there's things that healthcare providers can do, but what they are from a sort of a clinical, is there a magic pill or test we can do? There aren't any, is sort of my short conclusion. I do think we need to look at some of the impacts of a lot of other things that we're not thinking about. For example, diesel is really an understudied issue. What I'd like to know, and I framed this as what we'd like to learn, is sort of the range of exposures at these short setback distances, and how we develop smarter setback policies. Because I don't think one size fits all is going to work here, and this issue is not going away. It's controversial. It's important for the citizens of our state to I think, have public health protected, have their health protected. So we've got some ways to go. And I think part of that is sort of understanding the whole range of exposures, not just to air pollutants, but traffic, noise, light, and other things that disturb people that live near these sites. I want to acknowledge our funders, National Science Foundation, National Institutes of Environmental Health Sciences, University of Colorado, the School of Public Health, and my collaborators, both listed here and some others who aren't, just because there isn't enough room on the slide for all of this, and the usual disclaimer about that frees them from anything stupid that I said. So I'm done. Happy to entertain any questions.
We have time for just a couple. I'm going to read this.
Let me read this, a couple of them, the ones that I think I can answer. I mean, there's some great, I will say there's some great questions here, but there are more and more complex one than I can possibly answer in the time allotted. As there's no safe level of benzene, who, in quotes, or excuse me, in parentheses, in all oil and gas wells emit benzene, is zero release of benzene required to protect public health? The no safe level of benzene, the World Health Organization, let's start there. World Health Organization does have, or at least a recommended occupational standard that I'm aware of. I would say that zero release of benzene should be absolutely a goal. Oil and gas industry is producing this stuff, and zero emissions should be the goal, absolutely. Because one, they can sell it, and two, it would, as low as we can get the levels is I think, an important potential goal. I will say there's, if you look at the health-based standards that exist, and benzene is one compound of which there is one, there's actually emerging evidence that the standard isn't low enough, having to do with diseases that are less studied around blood disorders that are sort of pre-leukemic. I'm not an expert on that, but I do talk to my students about that. So I would say zero emission, yes, should be a goal. Do I have time to answer one more? Does geography of the Front Range, foothills, inversion, et cetera, make air pollution more problematic? Absolutely. I mean, that's why we're out of compliance with the ozone standard here, and We're not out of compliance with the PM standard, although there were, in the previous administration, discussions about lowering that, and I think we as a state would get close to that limit if they bumped it down from 15 to 12, at least in certain areas. Ozone, I think, is our biggest, sort of air pollution issue on a regional scale. What oil and gas is a air pollution issue very much at the local scale. So I think I'll stop there.
Can you hang on to those and possibly answer them on the website if it's not too much?
The problem with many of these is it requires a conversation.
Got it. Okay. Very well. Thank you, John.